Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel where we hope to celebrate unsung heroes, where we hope to inspire the next generation of leaders and shed light on global health issues. We celebrated the International Day of the Midwife last week, and we're looking forward to celebrating International Day of the Nurses next week and on the anniversary of Florence Nightingale's birth. So, in celebration of International Nurses Week in general, we bring a panel of amazing nurses from across several regions in the world to shed light on nursing as a profession and the future of healthcare. I'd like to introduce my co-moderator, Kelvin. Over to you.
Good morning, good afternoon, good evening, everyone. We're just, as Maimuna said, very excited to have this panel discussion today. My name is Kelvin Turner. I'm a regional director at Operation Smile, but let me go straight to introducing some of our guest panelists. First up, we have Miss Carolyn Bennett. Growing up in the cold Western New York State, Carolyn started her nursing career there, and it spans over the last 50 years, involving mostly critical and acute care areas. Currently refers to herself as semi-retired, but actively working. She started a part-time home business called Health Match Advocacy in 2016 to help anyone needing assistance in the medical arena. Welcome, Carolyn.
Thank you. Thank you very much. I'm delighted to be with this panel today.
Thank you. Next up, we have Miss Stembile. Timby is what she's commonly called, and from her native country of Zimbabwe. She is a UK-trained nurse, midwife, and MPH holder with over 20 years experience in various leadership roles in reproductive health and family planning and maternal child health. Currently, she's working in the US in the maternal newborn child health advisor, and we just want to say welcome to the program.
Thank you. I'm really glad to be here representing my fellow nurses out there. Thank you.
We also have Samia Rabat from Morocco. Samia holds a diploma in nursing, anesthesia, and intensive care from the School of Sciences and Technique Health of Monastir, Tunisia. She has over 19 years of experience, most of which is in the OR in the Children's Hospital of Rabat as a nurse anesthesiologist. Samia started volunteering her time with Operation Smile in 2014, which she credits that experience with expanding her scope, encouraging her to learn other cultures and peoples, and also to help promote team spirit, sharing, and caring. She credits that international work experience with helping her manage extreme pressure, working in highly stressful environments, and she has developed a strong capacity for prioritizing and working efficiently. Bienvenue, Samia.
Hello, thank you for having me with you today, and just would like to say welcome to everyone, and thank you again.
Thank you, Samia. Next, we have Gunilla. Gunilla Lööf is a Swedish-based pediatric CRNA who has been working in the pediatric section of Karolinska University Hospital in Stockholm for over 25 years. She has traveled around the world providing life-saving surgery to hundreds of thousands of children via her work with Operation Smile and other organizations. Gunilla also happens to be the founder of the worldwide used website Anesthesia Web, a platform that helps to provide information and preparation for children and caregivers prior to hospitalization, anesthesia, and surgery. Gunilla has a PhD from Karolinska Institute in web-based preparation and learning for children in the context of healthcare. Welcome, Gunilla.
Nurses. So thank you. I hope I will contribute to this discussion.
We're glad to have you again, Gunilla.
And last but not least, representing the male nurses on the panel, we have Mr. Artur Acelino from Sao Paulo, Brazil. He is currently a candidate for a PhD with a dual degree from the University of Sao Paulo, also in partnership with the University of Lisbon in Portugal. Welcome, Artur.
Thank you so much for having me. I'm really excited to be here today.
So again, thank you all of our panelists for joining us today. In celebration of Nursing Week, we just want to start off with a simple question. What got you guys started off in the nursing field? And I'll start the question off by going to Carolyn first.
I started in nursing right out of high school. Actually, in high school, I was in the Future Nurses Club, and I worked in the hospital since I was 14, and then went to nursing school right out of high school. I actually went to LPN school. That's the lower level of professional nursing, and I worked a few years after that, and knew that's what I wanted. I went to nursing school because my mother wanted me to, but then I learned to love it, and then I've just progressed, and I've traveled all over the United States. My husband and I are sort of gypsies, and we've enjoyed the travel, and I enjoy meeting different nursing professionals around the United States and around the world. It's been an enjoyable experience, and I can't seem to retire from it. So here I am, well over 70, still at it, still trying to do my best and help people. So it's a pleasure to be here.
Thank you, Carolyn. That's wonderful. I just think of the gypsy nurse. I love it. I love it.
Yes.
Stembile, please, the same question.
Okay, mine actually, I didn't set out initially to be a nurse, but I guess I was going to drift to that eventually at some point in my life. I was born and brought up in a health facility setup. My father was a clinical officer for years, so I interacted with nurses from a very early age. And after my high school, I ended up in England training to be a nurse and just loved it. I mean, just fell in love with the whole idea of caring for people, the whole idea of really seeing people getting better and going home. And over the years, I have interacted with a lot of nurses in different settings. And I'm still awed by what they do. I drifted onto public health as my path for professional growth. But I always believe that at the end of the day, I will always be a nurse. I will always be a midwife. I still have the passion for the profession and a great admiration for what nurses do. And I still believe that in as much as I'm working more in public health now, I still am a nurse at heart in everything that I do. So that's really my path into nursing. I wanted to be a teacher, and I guess I ended up in teaching because at some point in my life I did teach in nursing education. So that's my exciting career in nursing.
Thank you, Stembile. That's amazing. Just being exposed to it at such an early age and then allowing that passion to grow within you. But again, as you said, like in the nursing career, you still are serving as a teacher as well. So that's amazing. Samia, can I ask you the same question, please?
The first, before thinking on getting courses on nursing and being a nurse, I was on in the other side. I had inscription in University of Economic University, and once I was in Tunisia and with my sister and her husband who were training in the hospital as doctors. I saw one time with them in the hospital how is the amazing job nurses are doing and how they are closer to the patients and how they are taking care of them. So this time I decided to change from economic to anesthesiologist nurse. And here my adventure started. I held my diploma and then came back to Morocco to practice. I was in the ICU pediatric ICU, and it was just I don't know how to the word I can use to explain that, but it was just special feeling to be here, taking care of patients, helping, and sharing good times as the bad times. So that was the first step. Then with the time passing by, I was still looking for something special. Since 2014, when I joined Operation Smile, and finally I found what I was looking for.
Thank you, Samia. That's wonderful. You know, when I think about why you got into nursing, it just again brings up like that healing relationship that nurses have, that personal relationship that they have with their patients. So thank you for sharing. Gunilla, same question, please. I believe
because I was totally scared and afraid of hospitals and healthcare and doctors and nurses. So scared that when I was a little girl, I ran away from my own surgery because no one had prepared me for what to come. So, you know, hospitals and the medical field was the worst I could think of to be educated in. So I was totally focused on to be a teacher. And I started the education to be a music teacher. But after doing half of the education, I was a little bit tired of the studies, so I had a break. And then I was suddenly one day thinking, oh, maybe I should look into the nursing field. And I applied for the school. And yeah, that's the story. And today, many years later, I have a fantastic combination of my my wish to be with children, since I work in a pediatric hospital, but also in education, because nowadays I work a lot with education for children before anesthesia. So I think I'm a bit of getting closer to close the circle. But actually from the beginning, it was totally a mistake, and I was scared to death for hospitals.
Thank you, Gunilla. That is a wonderful path. Just being able to, you know, align like your past fears towards the work that you're doing today and addressing them for others. So thank you for that. And last but not least, Artur, I would like to ask you the same question.
I think I'm the other spectrum from Gunilla, because I always want to work in healthcare. And I remember having this aunt that she's a nurse, she's my mom's sister. And I always thought that she was the smartest person in my family. And I remember feeling and thinking that I want to be as intelligent as her. So I enrolled in nursing, and I fell in love with the profession. And my worldview is definitely changed by it. And early in my university, I discovered research in nursing. I also fall in love with researching and bringing my worldview to it. And that's it. And I think it was the right path for me so far.
Thank you, Artur. Yeah, just being able to have that nursing career in the blood already of your family is something that you look forward to. Thank you.
Thank you all for sharing your amazing paths to nursing and your experiences so far. It's interesting on this panel, experiences range from over 50 years in nursing to just under 10 years. So it's really amazing to see almost like 3 generations of nursing here on this panel. We're really glad to have you all. The International Council of Nurses gathered some data from different National Nurses Council, and I'll just like to read out some of those stats. It says that the global nursing workforce is estimated at 27.8 million as of today, and that the world was already facing a shortage of about 5.9 million nurses before the pandemic. ICN further estimates that due to COVID, there's going to be an added shortage of nurses because of aging population and then people just leaving the nursing workforce, which could lead to a potential shortfall of nurse by up to 13 million nurses by 2030. Those stats are really shocking. Now, then, in addition to this, they say close to 90% of those shortages are concentrated in low and middle income countries. Brain drain, loss to other sectors have been alluded to as factors that lead to that huge nursing shortage in specifically low and middle income countries. So, Artur and Samia, can you please tell us from your experience how this trend can be stemmed and what governments and institutions need to do to address this nursing shortage? We'll start with you, Artur.
Thank you. The shortage of nursing professionals is something that's really concerning. I'm talking about my reality in life in Brazil, that have been suffering tremendously with the pandemic. Nurse professionals' deaths in Brazil due to COVID-19 are 1/3 in Brazil, and this can bring serious impacts for the health system resilience, especially due to a lack of value that the government puts in nursing. We are not seen as valuable resources and professionals. This drives away new nurses for coming to the profession. This drives away old nurses in the profession because they don't see a structure to work. And I think it's really concerning on how this discontinuation of the new generation can impact health service. Once the universities are falling short in preparing new nurses due to the pandemic and other shortages of resources, and how we are losing a lot of good professionals to the COVID-19. And experience is something that you can put a price on, and we are losing a lot of valuable professionals right now. I believe that the government should look for nurses and provide adequate vaccination equipment and protection for them, because you are losing amazing professionals. And I think that this can be a really bad impact for health services in Brazil in a medium and long run.
Thank you so much for that response, Artur. How about you, Samia?
Highlight the role of nurses and how is the work they're doing, and how is amazing being a nurse. Nursing is what enable health system across the entire world to achieve. And nurses are humanity. Serving humanity, and by their action, they're protecting health and well-being of individuals, community. So the pandemic COVID-19 show us many problems and issues that the health system is no. In my own experience and from my country, there is everybody knows that Morocco had a good managed good the pandemic COVID-19, but still having more things to do, like what Artur said: protection, vaccine, treatment, equipment, and also motivate people to be interested by studying nursing, because we are losing the best part of the team in hospitals. Nurses are the key of the team. So without nurses, I don't think that everything is gonna be able to go smoothly with safety and in good harmony. So if today we can take the opportunity because we are celebrating the International Nurse Day, to highlight role of nurses, as I said in the beginning, and to make people fall in love with this studies, with this profession, because it brings a lot of things in our life, and also on the life of the people around us.
Thank you for sharing your thoughts, Samia. Along those lines of the nursing workforce, it's estimated that 1 out of every 6 nurses is expected to retire over the next 10 years, meaning we'll have to educate 4.7 million nurses to just address that backlog. So, Tembi, Gunilla, and Carolyn, in that order, are we doing enough? What can institutions do to scale up nursing education programs?
Thank you for that question. I think if we are to even get to 50% of what is required, nursing education should be the backbone of what we do. I think we need to look very critically at how we are training nurses and what we are training to do. Many years, people could enter nursing after high school with a Cambridge O level, but we have upped that up to A level. And my argument is, if somebody gets A levels and they have the A levels that are expected, and there's so many options of what they can do, why would they then go into nursing, which is a less considered a less job, like what Artur has said? I think one, we need to get into those schools and market nursing, not just as a noble profession, but as a profession that has career growth for a lot of the young girls that are making decisions about what they want to do in life, about what they want to do. I think we need to capture them much earlier in the schools. The second point is, once they come into the nursing education, the institutions that are there, you need both public and private sector partnerships. You need the private institutions, you need the public institutions to get more people into nursing. There are some countries that are doing well and that take them, if they don't have the prerequisite academic or school requirements, they take them and they have this, okay, we'll take you into nursing, you'll start your nursing, but you also bridge and get those sciences or math that is expected for you to continue nursing. I think that should be encouraged, that should be scaled up where possible. I think we need to look at what is required for somebody to come into nursing as a profession, because I think the requirements, the educational requirements, some of them in some countries are very restrictive for people who really genuinely want to be a nurse, and they just didn't get those A levels in math or A levels in chemistry or physics. I think we need to revisit that and say, are we blocking people out of a profession because we are very, very rigid in terms of how and what is required of them to enter the nursing profession? I think the other thing is, we really need to look at nursing again. What do we need? What are we looking for? Are we training people to be nurses, or are we training people to be something else? And I always say that nursing is one profession where you expect people to enter and then specialize. Whereas if you are looking at a lot of the apprentices and a lot of the technical jobs, which nursing, I believe, is, you have people that, if you're a carpenter, you enter in as a carpenter. If I want to be a pediatric nurse, I should enter as a pediatric nurse, or I should enter as a nurse anesthesiology, or I should enter as a cardiac nurse, not start with this background nursing and then go on to become what I want to be. I think the other thing that we need to look at when we are looking at increasing nurses that are coming up, I think we tend to think that you just increase the intake just like that. We don't look at the entire ecosystem of nursing education. We don't look at we think you can get an infrastructure, but we don't look at the educators and ensuring that we have adequate educators to be able to provide that nursing. We don't look at where they do the practicum and the preparation of the people that actually guide skills acquisition in the practicum area. We don't look at the other resources that take into nursing. Are there any libraries out there? Where do you post them when you post them? And I think in nursing over the years, we really, really need to market nursing as a noble profession that has a career ladder that will take you to somewhere where you will be recognized. For us to get those young girls who are making decisions on what they want to do in life and might be inclined to do nursing, if we put nursing out there, not as a job where you are just walking around the corridors and following doctors and doctors' orders, but as a very, very important career, just important like any other career. I think we are not doing enough. That's from my perspective, to market nursing and as a really key profession that has a lot of contribution to make.
Thank you, Thembi. And I really like, as a true nurse educator at heart, you talked about the entire ecosystem of nursing education needing to be revisited. So over to you. Gunilla?
Thinking, as you ended and say that it's a key profession, and that of course we all can see over the world, not at least in the middle of the pandemic, even here in Sweden, I can see the biggest crisis in the healthcare up here and in the Western world. It's not the lack of doctors, not the lack of equipment or beds, but it is the lack of nurses. That's a really crisis for the healthcare in the future. And I will also add that it is a lack of experienced nurses who have continued to be working as nurses, because here, as in many countries, experienced nurses run away from the hospital, find other work, and the situation comes to that new educated nurses have to learn the new ones. So you don't have because as in all parts of the life, you learn from different generations, and you have a mix of a range of people with different ages and experiences to have a good team. And here I see, as I assume it is in many countries, we lose the most experienced, the oldest nurses, because they go away to other sectors for many reasons. And one reason is the salaries, because the salaries, it's not increasing when you're experienced. You have a certain salary when you come into the profession, and then you can go up maybe in 5-10 years, but then you're not or increasing your salary when you stay in the healthcare sector in the hospitals. So of course I understand that nurses with 25-30 years of experience go away from the hospital. And but here we can see that's a really problem, because new nurses learn from new ones. And today, to be experienced in a team here, you maybe have worked 2 years and then you're the most experienced, which you of course not are. And so that, I think it's a big issue. And also I think we need good mentors, because I am proud of my work. I don't want to be a doctor. I am not the B doctor or C or D doctor. I am a nurse with my own profession, and I love being a nurse. But what can be more for me, it's so important to think about to be close to a patient in a really vulnerable situation. For me, that's a big gift, and I'm so glad for being a nurse, but I have to be a good mentor. And for me, nursing is a fantastic job. You can have a lot of different careers. You can work abroad, you can do research, but you have to work hard. You cannot only sit there and say, no, we have low salary. You have to educate yourself. You have to follow the evidence and do research. And the best you can do is to do a mix of it. And so I think good mentors and keeping the good mentors within the team so they can mentor the younger generations and inspiring them to this fantastic profession. So I think a good team with a mixed generation and mixed experiences makes good mentors in the team, and I think that's a key part.
Thank you, Gunilla. And it's interesting you mentioned that word mentorships, which I think cuts across all sectors. So, Carolyn, with over 50 years of experience in nursing, what's your take? Are we doing enough to train nurses? And then what can be instituted to expand nursing education initiatives?
First, I want to say thank you, Gunilla and Stembile, for really good insight into their background and what they think is important, because I agree with them totally. When I entered the nursing profession back many years ago, women, or most women, because it is a female-dominated occupation, but mostly women of my era, you could be a nurse or a teacher or a clerical worker. There was very little out there. The internet wasn't there. We didn't know about so many opportunities. Plus, women were the minority. We were not leaders. Women were supposed to be housewives, and so you had to break the mold a little bit, even when you were. Even back then. And so I think we've come a long ways in that time frame. But now women especially have so much more opportunity. And I can remember a time in my life when I thought, oh my gosh, all this internet stuff is coming and computers, and I could have done so much better. But now I look back on it and say, no, I was meant to be a nurse, and I'm a caring person. And when you work with machines, it's different. We need to work with people. So I think the choices are so much broader. So people are not going into nursing because they have different choices than we had as younger people of my age. And then I really, really feel that the academia, nursing education needs to take a higher position. They need more. That's our foundation, is nursing education. And I don't think nursing education gets the support it needs. I knew as a hospital nurse, I worked a lot, and I worked in critical care areas. So I got paid more than most people got paid, including university professors. Their salaries are low, or they certainly are in the United States. And so I think that a lot can be done. I think we need to enlist governments. We need to make this a little more political. We're the backbone of our people, of our health, and so it just seems like that nursing should be made a little more political, so you could get your people that hold the purse strings involved in making this profession a little bit stronger than it is right now. Because even in the United States, we're considered one of your high-income countries, but we have much of the same problems that all of the countries have. Our nurse shortage, just in my state, and my state is a small state, is about 25,000 nurse shortage right now, and by 2030 it's going to be probably triple that. So there is a huge shortage here, and some of the things that I think that are happening, a lot of people my age are retiring, but a lot of people aren't. And I find many of my friends, I have a friend who that I'm pretty close to, and she's still working in the OR, over 70, and very productive. She's doing a great job. And there are many people in academia, as some of the professors are staying on much longer than they used to. When I was young, you just retired at 60 or 65. You just didn't work anymore. And that was the norm. And now I think the norm is changing. There are those who still want to retire young, but many nurses love what they do, as we all do. And I think they just want to continue doing that. But I think more focus on education, more focus on getting the government people involved. I serve on my Arizona Peri-Anesthesia Board, and I'm the governmental affairs person. So I go to Congress every year and I follow the bills, and we try to elect nurses into the legislature. We try to inform the legislators. They really don't understand healthcare. So I think as nurses, we need to be educators to outside of our arena. We need to move on to the people who do hold the purse strings to support education. And I think that would go a long way. I think that our government, we have a great government program where the U.S. government will pay for your nursing education. And this is more than just nursing, teachers and other occupations, but nursing is what I know about. And so they have a program that will pay for your entire nursing education, everything, and give you a stipend to live on. And I get the information every year and I pass it on to everybody that I know that might know somebody that might take advantage of it. But it's not a well-known program. And I would challenge the U.S. government to make it more available, publicize it on TV the way they do drugs. They need to make it more public, because a nursing education in the United States, you could graduate and have a $100,000 school loan. And most people just don't want to do that. And so they just don't do it. It's very expensive here. But if they would be willing to, the strings that are tied to the government scholarship that is available, is you have to work in a deprived area for a couple of years. And I think that's nothing to give up. But most people, I think we've got a generation of people who they don't think they have to work hard. And I think Stembile said you have to, and Gunilla too, you have to work hard. It has not always been easy. My starting pay a long time ago was little more than $1 an hour. And that's very, very low, but it didn't matter. It didn't matter. You do fine in the end. But I think we need to target our legislators, get to the people that can do something about it. And we do have numbers. And one of the things that the American Nurses Association brings out constantly is that we are the biggest. The nurses make up the largest workforce in the United States. There's nothing bigger than the nurses. And so if we would band together, and that's another problem, nurses tend to be, back off, and they go and do their job. And I've always said that there's probably half the nurses just use it as a job. It's a job. It's not a profession. And then there's a few, and hopefully more than a few, that use it as a profession, that want to see advancement, that are willing to give their time and energy in promoting nursing. And I think we need to come up with ways to make nursing more more appealing to the young ones. The average age of a nurse in the United States now is 50. That's sad. The young people are just not going into the profession as rapidly as they did in the past. I think because they can do other things, or it's too expensive, or they just don't know. We do need to promote. We need to promote and advertise and get out there and get in everybody's faces so they understand what nursing is, because the world is going to suffer without nurses.
Yeah. Thank you, Carolyn. I agree 100%. You know, I think a greater focus on education at a younger age, more involvement and support from government institutions as well, will help us in that area of recruiting more nurses. I want to kind of change the topic a little bit. Over the past year, we've all been affected by this global pandemic, and I want to get I have some stats, but I want to get your thoughts on, you know, how has that directly affected the nursing industry, the nursing career for your individual countries. So as of December 31st, 2020, more than 1.6 million healthcare workers in 34 countries have been infected by COVID-19. In many of these countries, the nurses are the biggest health worker group from this stat. For instance, in Mexico, nurses comprise of 41% of the confirmed healthcare worker infections. As of January 31st, 2021, the cumulative number of reported COVID-19 deaths of nurses in 59 countries was 2,710. But we believe that there's a lot of significant underreporting in this area. So I pose this question to Artur and again, Caroline. What are your experiences now in regards to, you know, how COVID-19 has affected nurses in your country, but also what are some solutions that you may have moving forward? And Artur, we'll start with you.
In Brazil, in 2020, over 44,000 nurses have been removed from work due to the pandemic. And like I said, the nurse technicians, nurses assistants, and nurse professionals are being severely hit by the pandemic and lack of structure for their work. We are not receiving adequate equipment or vaccinations and protection as a whole. And this is being severely impacting our daily work and also perspective in the future. We are not enough professionals, we are not enough adequate equipment to work, and we are not receiving support even from our peers. In Brazil, this year, we are trying to get a minimum pay wage for nurses, and even in the middle of the pandemic, medical associations and hospital associations are being against this legislation. So this is damaging the present and future of the profession. I think a way to amend this is by governmental support in looking at this profession as the value that it has and providing a good structure for us to thrive, not only now in the middle of the pandemic, but in the future, because this shortage and this impact are going to last. They are going to be felt by years from now. And I don't think the health system can support losing more nurses. And even with the start of vaccination in Brazil, a lot of medical associations or hospitals are denying paying compensation risks for the nurses, and sometimes not worth it. It's not worth to risk your life and not being paid adequately, or being away from your family, or not seeing your family at all because you're being away in the hospital with no perspective. I really think that we need to look for now. We cannot wait another year. We cannot wait another 6 months. These things need to be done now. We need protection. We need vaccinations. We need to survive this, because we cannot take care of others if you are not well.
Yeah, that is a very good point, Artur. You know, being able to make sure that you have that protection in your country, being able to make sure that they also offer those incentives for nurses who are on the front line and at risk. Carolyn, I would love to have you briefly answer the same question, please.
I think in the US, we're fortunate that I don't think there were many places that went without PPE equipment or adequate supplies. I think the nurses rallied, and I think they did what they do best. And I think to the incident last year at some point, I can't remember when it was, but last year, New York City, which is a consolidated mass of people, the population is consolidated all on that little island, and there's so many people, and so many people were dying, and they were like needing nurses. Many of my friends, they just the governor of New York did a rally cry and said, we need nurses to come here. And I know of many nurses who just dropped everything and went to New York into this hotbed, and they were successful. They cared for the patients, and it dissipated after a while. And I think that many other situations, nurses have become a hero from COVID-19 in the United States anyway. And it was in part that nurses knew that they would have protective equipment and adequate testing. Unfortunately, there have been many deaths. I don't know how. It's in the low thousands, I think, and that's a lot. It's a lot. But I think COVID has opened our eyes that we didn't have things in place. And I know my state, our governor is a very proactive governor, and I've been happy with his handling of our affairs for the people in Arizona. Right away, when COVID became a problem, there has never been a consolidation of all the nurses in the state who would be willing at a moment's notice to help. And our governor saw that need right away. And so a year ago, more than a year ago, a notice went out to every nurse who was licensed in Arizona. Would you be willing, should any public health event come along, to help out? And lots of questions. And then I answered the call, and they checked our paperwork. And a couple weeks later, I got the okay, yes, you're approved. And now we have this state-run emergency response team. And so I would, every time when they set up for the immunizations, I got a notice. We need nurses this hour and this hour at this place. If you can do a 6-hour shift, do it. I thought that was an ideal way to mobilize the state. I really don't know how other states did it, but I was really pleased in the way our governor responded to it. And I think I'm happy with the way nurses responded. It's sad, but we learn from things.
Yeah, that's very true, Carolyn. And I think it's interesting to see that not necessarily a stark difference, but just the response in a resource limited setting versus in a resource rich setting with how they just responded to COVID, which brings to light that issue of health equity and the fact that nobody is safe till we are all safe. So you all had touched on this issue of leadership and the nurse workforce. It's said that nurses account for more than 70% of the health workforce, but hold 20% or less of leadership positions. So I would ask you first, Samia, what can we do to change that trend? And afterwards, you, Tembi.
Pandemic COVID, the global COVID showed where the important role that nurses playing in keeping people healthy across the lifespan. So Now from where to start. Sorry, can you repeat the question? I'm lost.
Yes, like what can we do to ensure that nurses can get into leadership positions?
Yeah, okay. Talking about it, encouraging nurses to be in leadership and giving them a position to manage and to manage situations and I don't know how to say. I'm sorry. I will be back.
No, thank you, Samia. And I think you've already alluded to it, is allowing nurses to have that experience in managing, not just administratively, but allowing them to coach other nurses as they develop their leadership capabilities. So over to you, Tembi. How do we develop leadership in nursing?
I think nursing is a profession. Is really has a lot of leadership responsibilities. Just managing patients, just managing wards, the clinical setting in itself is leadership. But when you look at nursing education curricula, that is not highlighted at all. There isn't any dedicated leadership training that goes in with the leadership responsibilities that you're supposed to have. A lot of people, you get promoted. I got promoted and became a ward manager, but and nobody had prepared me at all for that leadership responsibility. And okay, they prepare you for how to do the duty roster and things like that. But all those skills that are required for leadership, I just looked back and thought I could have learned some of these skills in my nurse training, preparing me for that responsibility right from the beginning. And again, we need to look at including leadership in curricula. I think nurses need a voice. It took many years of advocacy, for example, for WHO to have a nurse in WHO headquarters representing nursing. It should not have taken that many years. I think we are many and therefore should have a bigger voice. I actually don't think one person sitting in WHO is enough to represent the millions of nurses that are there and represent the issues of various nurses. I think we need more nurses from different settings in those leadership roles. And it goes back to, yes, when you interview, because you don't have the leadership skills or the leadership know-how, nobody trained you and prepared you for it, it's very difficult to put yourself across as a leader. I also go back to the International Council of Nurses, the International Confederation of Midwives that represent nurses. I think we need to make our voices much, much louder. And I think when you also at country level, there is always a department of nurses. Nurses did well. They advocated that you need a department of nursing within a Ministry of Health, within a public sector institution that represent nursing. Usually it's the least resourced of those departments. It probably has one or two nurses, if you are lucky. And their voice is not heard loud and clear because they are said not to have. I think the health sector is not good at preparing leaders. They are good at promoting people into positions, but not good at preparing leaders. And I think it's very, very critical for nurses. I think we would be having a much, much louder voice if our training in nursing education prepared us to for those leadership roles and leadership positions of the future that we are supposed to have. I think somebody mentioned mentorship and saying, how do you mentor? I talk a lot to younger nurses that I come across, and they say, oh, how did you get there? How did you get into your position? And I've always said, you know what, I can mentor you, but one of them eventually said to me, yes, you have mentored me, and I believe I have leadership skills, but I don't have the certificate. I don't have the piece of paper to show that I can make it. And I think it's again those barriers, those restrictions. What are we looking for when we are looking into a leader? Because any of us, I think any of the nurses that are on this panel can mentor a future leader in nursing tomorrow and mentor them very, very effectively. I think it's a shame that we have such a small percentage of nurse leaders representing the biggest number in the health sector, even in those key positions. I think we need to do more. We need a shift in mindset that unless we put nurses to be the voice of nurses, we are not getting anywhere. I think most of us are beginning to talk very, very loud. I remember not very long ago, I was the only nurse on a panel that was discussing, not a panel, in a meeting that was discussing issues that had to do with nurses. And I said, you know, but the nurse is the one who looks after the neonate, after the sick baby. Where are they? They are not here. You're all here, you're all doctors, because they are very, very restricted. They are not. They haven't done the research. They haven't done that. They haven't had the opportunity to have something to present at this forum. I think we need to take these issues very, very seriously. I think we need a voice. We need the ICNs, the ICMs to continue to just dedicate one day of the nurses, not to celebrate Florence Nightingale anymore, but to voice these key issues. And like Carolyn said, put them at the forefront of the people that make decisions. Because if we talk about it, it goes. Again, next year, we will be celebrating International Nurses Day, and we say, what difference have we made? We need to focus on one issue at a time and just make a lot of noise about it. Thank you.
Thank you, Stembile. I mean, you hit it right on the nail. I think being able to have nurses in those leadership roles, you know, allows the people that are coming up, the young people that are entering into the healthcare field, gives them someone to look up to, allows them to be able to seek for mentors. So if we have more people in those leadership roles, if we have more training to become those leaders, then I think that will help out the nursing career, the nursing field a lot. So our next question kind of relates to the month of May. So the month of May is Mental Health Awareness Month. And there are some stats that says like 80% of the International Council of Nurses said that they had surveys that responded and reported that mental health distress from nurses from working in the COVID-19 response. So my question is, in your experience, you know, what ways would you equip the system to support adequate mental health prevention, treatment, research, et cetera? And I want to pose this question to everyone. So let's start with Artur.
Thank you. I was thinking about this question, and I think that especially during these last months into fighting COVID-19, the long hours, the being away from our families, working in hospitals and dealing with death daily has a traumatic impact that cannot be perceived adequately right now, that need to be assessed and evaluated in future researches even, because I truly believe that we are professional as a group. We are dealing with a never before experienced level of trauma, because for many of us, we are risking our lives, we are risking our families, we are seeing no perspective in dealing with a burden of debts that never been seen before in our lifetimes. And I really don't think we understand right now how this is impactful in a long time. I really think that as nurses and researchers in nurses, because I really believe that data and science is important to drive our future endeavors in decision making, we need to assess how we are dealing now and how this is going to impact in the long run. Because we have experienced nurses, but we also have people that never deal with something like this before. And to establish data centers and data research around this can be really valuable to understand how this impacts and how we're going to deal with this to provide how can I say that? To provide specialized care for these nurses. We need to make a commitment to the mental health of our professionals, because all of this hopefully is going to pass and we're going to survive this, but survive not enough. We need to be well, and our mental health is a priority, I believe, aside from our physical health, but we cannot have sick nurses taking care of people in the future. And I believe that nursing schools and government need to prepare right now researchers to deal with this in a continuous way.
Thank you, Arthur. Gunilla, I'll pose the same question to you. I believe you're on mute, Gunilla.
Okay. Now you hear me. First, I think, of course, I think it's the same in all countries. We need more nurses in the system. And the second, as I said before, I think for also keep a good mental health, I think a key answer is to have this mixed teams with people of different ages, including different life and work experiences, who can support each other. I push this very, very much because here we see there is a lack of that. There's so many new educated and young nurses in the teams, and we need a mix to help each other. Because if you have seen things, of course, we haven't seen a pandemic before, but we have been in tough situations. The older you are and the more experienced you are, I think you have seen and been through situations, and that's a good ground to help the nurses who might face this difficult perspectives for the first time. So more nurses in the system, of course. We need more people on the roster, and number two, mixed team, where the people with increased with a higher level of experience and life experience also and work experience can help the younger ones, and the older one can learn from the younger ones. So it's vice versa. But I think mixed team will help a lot, because my experience when I have been through tough things in my work, it's not to go to like a psychologist, these debriefing panels. It's good, but the best for me, and I know for many nurses in my hospital, is to sit and chit chat with the group you're working together with over a cup of coffee. You can handle so many difficult things together with your colleagues, but to do that you need a mixed group.
Thank you, Gunilla. Samia, I will pose the same question. In your experience, what is one way that you would equip the system to support adequate mental health prevention, treatment, and research?
In the beginning, we should show some gratitude to the nurse for the work and the job they're doing, and taking on having enough person and educating more nurses to make the team having some rest and get disconnected from hospitals and work. Then as we know, all of us, that in the team we are supporting each other. We are our psychological support. We are helping each other to pass by any bad episode in our days. So this is the only thing done today for the nurses. I don't think that the system or the government saw the problem, the mental problem that can affect the nurse after working a long shift with the huge schedule and the working day after day without taking the time. And I think by the also again I'm gonna talk about it. The pandemic COVID-19 show us that the nurses are really supporting a higher pressure, and they are the bridge between the doctors and the patients. So I think that we should keep an eye on our nurse, thinking about them and trying to find somehow to make them stop working and thinking of themselves, because we are nurse in the hospital, and also we are nurse when we leave the hospital in our house with our neighbors, friends, kids. So we are the person who's taking care of all the world around us and forgetting ourselves, and people forget also that we are human, and also we need to be that someone take care of us and show us his gratitude. And there is also a salary that we talked about it in the beginning. I think this is also a good point to discuss and revalue the profession, because it's inestimated work we are doing. It's whenever you give, in my own experience, the salary is low for the job the nurses are doing. So I think that the government and the Ministry of Healthcare should highlight those points to take care of the mental of our nurses.
Thank you, Samia. You bring up a good point, because we're nurses, or you guys are nurses, 24 hours a day. While you're working in your profession, but also when you get home for your neighbors, for your family as well. So it's important to take care of our mental health. Stembile, I will pose the same question. What is one way that you would equip the system to support adequate mental health prevention, treatment, and research moving forward?
I think I years ago, not less than 10 years ago, I was leading a health workforce project in Southern Africa at the height in 3 countries that had the worst HIV problems. And we started a program called Caring for the Carer, which really just targeted health workers, addressing various issues, because those nurses were part of the general population that was equally affected by HIV. And when we looked at the occupational, all those countries under the International Labour Organization do have occupational health for the employee, and it didn't have anything that had HIV on it. We are now in COVID, and I can bet you there isn't anything that addresses mental health for the nurses. I think it's been said we need to care for those carers. But on the other side, unless, for instance, in the region where I come from, mental health is stigmatized, they will not come forward. Nurses will have depression from COVID and will not talk about it. until they break down. I think unless we actually know and fight that stigma and provide services that are safe for me as a nurse to go and be able to say, you know, guys, I'm breaking down, I'm falling apart, I'm really depressed, without and be protected from the stigma that carries that. I think that's something that needs to be addressed if we are to address mental health successfully, at least in my region. You need to cut the stigma so that when nurses are feeling depressed, when nurses are having mental health issues, they have somewhere safe they can go and get this care. We saw it in HIV. There were very, very few places a nurse could go, get tested, and be found positive and seek ARVs. And as a result, they were dying. And it was, we had to, in this caring for the carer program, stigma was a major, major issue that we addressed. We had to ask those nurses, where would you go? Where would you feel safe to go and talk about HIV and talk about AIDS and talk about your spouse living with HIV or having died of HIV, and therefore you probably also have? Again, let's talk to them. Where would they feel safe to go without feeling stigmatized and openly talk about mental health issues? I think I'm speaking for my region. It carries a lot of stigma. In the last few weeks, I know I've spoken to a lot of nurses, and some of them I could sense the depression at a distance, reaching out, and I would say, you know what, it's okay for you to go to your psychiatrist. It's okay for you to go and talk about this to somebody that you are falling apart. As a result, they leave the profession, but we know leaving does not treat mental health. You removing yourself does not treat mental health. It remains with you. It affects them because it's a health issue that needs to be addressed. Thank you.
Thank you so much, Stembile, for bringing up the point of stigma. I don't think your country or community is unique in that. I think there's communities in a lot of countries around the world where there's a stigma on seeking care for mental health. So thank you for bringing that up. And last but not least, Carolyn, I would like to pose the same question to you. What's one way that you would equip the system to support adequate mental health prevention and treatment? I think you're on mute.
Can you hear me?
Yes, sorry, please proceed. No.
I just have to agree with you about the stigma. We probably have less stigma in the United States. Every hospital that I know of has a hotline that you can call for counseling, but most people don't take advantage of that. Most people don't. So the stigma of mental health, people aren't going to admit that they have a problem. But I believe your best bet, and someone said it there, is friendships. You get together and you can talk about it among your friends. Your mentorship is so important, not only in learning what it is that you need to be doing, but in your profession, but in your own mental health, so that you can be a successful practitioner. It's really, really important to be able to have a mind that is not cluttered by problems that would inhibit you being the best nurse in whatever you're doing. So the answer to that, I don't know. In my own life, I think having friendships, having colleagues, having groups helps. Health match advocacy is what I formed a number of years ago. And I'm an independent advocate for people who have health problems. They come to me. I work out of my own house. I go to houses to visit, or I talk on the phone. I'm alone. I don't have anyone with me. So I was instrumental a few years ago in getting our Arizona Advocate Association together. And so now we're on a 2-year journey, and we're just beginning to really get our credentials in place. But the association that I have with them helps my mental health, in that, to know that I'm not alone. We share problems, and we share our thoughts that have to do with the problems of work, not the specifics, but our own mental acknowledgement of what is going on in our lives. And it's interesting because I'm just working on getting a website, and we have social connection as part of our that we want to offer to our group and all the members of our group. And I've been reading a little bit on that, and I'm mental health is not my background at all, so I'm really a novice at this. But I think it's really important to have an outlet, have somewhere else that you can go and do, like go to dinner or go out and do an activity with someone where you're not talking about work. It's good for your mental health to be able to disengage for a little while with friends, with safe friends that you can, you may be shopping, but you're still maybe talking about, oh, I had this terrible day at work, and this happened or that happened. And to get acknowledgement from your peers in a social setting away from the workplace, I think is very important. And so in my limited background with mental health, that's what I would have to offer, is just don't be isolated. Have mentors that you can talk to, have friends that would understand you, and don't be afraid to talk. And I've said it more than once to people that, I'm pretty outgoing and I share everything, but I have friends who don't feel comfortable sharing. And I said to a friend who had that problem, I said, if I've got a problem and I'm just upset about something, I'm going to share it with you, because that's going to lessen the burden on me if we can share. And then it works for me. I don't know if that really would work for everyone, but I think friendships and outside groups and doing things outside, but having those peers that you can feel that you're open with, because the stigma does still exist to go to a professional. And I don't know how to change that.
Yeah. Thank you so much, Carolyn. I agree 100%. I think being able to have, that core group of peers, that core group of friends that you can just confide in and speak to and express yourself, your thoughts and your feelings is extremely important for our mental health. So we have gone over on time. Again, we want to thank you all for joining us today, and thank our audience as well. There are a couple questions in the audience chat. Unfortunately, we're only going to have time to take one. So let's look at the one by Indira. I hope I pronounced her name correctly. How can we involve or bring more men into the nursing profession? And we will address this question to Artur.
Thank you. That's a current topic that I have been coming across in my years as a nurse. And I have two views on that. I have a professor that discussed this with me a couple of years ago, and I really think about it. Nurse is evolving. We are not the same profession that we are 20, 30 years ago. We are becoming more confident, more proper access to our own knowledge, not medical or other professionals, our own body of knowledge. Nursing knowledge is important. And getting this confidence in coming across new areas like technology and the use of e-health, m-health, or even robotics in nursing is a really interesting topic that are inviting young men to nursing because they are seeing a new profession that's not represented in media or in their schools before. And I really like this approach. But I also have a few concerns about this because I don't think we need to reinforce this idea that technology is a field for men, not for women, and that we need this to attract men. I think that's a good point, but I also want to, I really like nursing as a way to challenge our gender norms. I have been in a female-dominant field for years now, and I have really incredible, strong women as my role models. And I really like this idea that we need to teach our boys to care, because for me, nursing is caring, and to provide this idea that they be in a profession of caring, I think that can be really beneficial, not only for having more men in nursing, that I think that's positive because we can provide identification for male patients and bring new perspective to nursing field, but also to have more caring men, to avoid toxic masculinity and to become a better version of ourselves.
Thank you so much, Artur. You definitely bring a unique perspective on encouraging, across gender to be involved in nursing for what it is. And then, of course, you've brought in other topics like toxic masculinity and then gender bias and stereotyping. So we really appreciate your honesty in that field. So like Kelvin said, we're definitely over the hour, but we feel it's really an important day to celebrate International Nurses Week. So we appreciate you taking that extra time. As we wrap up, I just wanted to ask you all 2 quick questions that I want you to answer quickly. And basically, the theme for 2021's International Nurses Week or Day is Nurses, a Voice to Lead, a Vision for the Future of Healthcare. So I would ask each of you, and in this order, Tembi, Carolyn, Gunilla, Samia, and Artur. So, and I want quick responses. What is one thing you are most proud of in your nursing career? And then what is the future of healthcare? So we'll start with you, Tembi.
I think one of the things that I'm most proud of in my nursing care, in my career as a nurse, is the caring, the passion, regardless of where I end up. I could be in a very high-tech hospital in New York and in a rural health facility somewhere in the middle of Africa, in Zimbabwe. I think that nursing, that bond between me and my patients is something that is really to be recognized and that I'm proud of. Nursing in the future, I think one of the things that we need to cut up and one of the things that we need to focus is these pandemics like COVID has unearthed a lot of disparities within the borders of countries and countries. When you think technology is driving the future of healthcare, and I was saying to one of my colleagues, yes, we'll have these little robots doing nursing duties all over. For me, one thing comes to mind: the nurse who is in rural Zimbabwe and all she has is her phone and nothing else. And that's her technology. Are we thinking of her as we think of the future? And the train is obviously hurtling at a very fast pace, being technology driven. Unless we think of that nurse, we'll never bridge the disparities that we are seeing now. They will remain with us. Thank you.
Thank you, Tembi. And I really like you highlighting equity in healthcare and where there is no health till everyone is healthy. So that's something to definitely think about. So Carolyn, you quickly, what is one thing you're most proud of in your nursing career? And then what's the future of healthcare?
Gosh, I don't know what I'm most proud of. I guess being here and being able to still be a nurse at my age is that brings me pride. The future of healthcare, I think we're going to see lots of changes, lots and lots of changes. I think we're going to have to take more leadership positions. More nurses are becoming higher level leaders, but not enough. And those higher level leaders is going to have to train the lower ones. And I think even in the United States, we have nurses aides, we have LPNs, we have technicians. When I started nursing, there was no respiratory therapist. That grew out of nursing. I did all the respiratory treatments when I was a young nurse. And so I think there's going to be more and more pulling from what we did. I think was probably in my we did everything. And now we're doing less. We're focused a little bit more. And I think leaders of the future to be highly focused, running, teaching others to do narrow spectrum nursing, where we learned broad spectrum nursing. And I think we're going to have to narrow it. We're going to have to rely on, we are relying on technology. I'm not sure that that's good, but it's happening and we have to go with it. But I think nursing is going to change, a huge change. It's changed from Florence Nightingale and it's going to change from us.
Thank you, Carolyn. And we hope you get to stick around for decades more to see that change. So Gunilla, over to you.
Me too.
Actually, what I'm most proud of is to be having the courage to educate and work as a nurse, despite my own experiences as a child. And I'm also proud of that I have been able to help children to not being forced to meet the healthcare unprepared, as I had to do as a child, because I know how that affected my contacts with the healthcare when I grew up, and I don't want children to face the same as I did. I'm also proud of the curiosity which I always have to learn more and never stop to educate myself. And in the future, I think that, and I'm totally convinced that the healthcare have to include web-based technique as a complement to the personal meeting with the professionals at the hospitals. I'm not saying that's going to take over, but it's a really good supportive complement to the personal meeting, which we all have to learn and use. So I think it's the technique is the web-based technique. It's going to come more and more, not at least after this pandemic when we had to learn it.
Thank you, Gunilla. And you definitely embody the use of technology to improve healthcare overall. So you, Samia, over to you.
I'm proud of being a nurse. Through my career, I touched special. I felt I had the special feeling with patients, sharing with them the moment, and I mean, even it's a short moment. But taking from my position as an anesthesiologist nurse, taking the kid from the mom who's here, coming to confident, giving us their kids and asking us to help them. And at the end, the surgery, you see that you did something, and you see the recognizing in the face of the family, the mom who's thanking you and sometimes crying because you were the person who took care of her kids. It's something that makes us feel really proud. And This I felt it especially with Operation Smile, when the first time I saw the huge number of the kids with birth defect and the family who are here coming to ask for changing lives, giving a new smile to those kids to have a normal life. That makes me also feel more proud of being a nurse. For the future, I think that, as Gunilla said, the technology is the most important thing. We saw this especially in this year with the COVID-19, that only the person who are affected with COVID were able to go to hospital to have a treatment and to get to take care of them. So some people died not because of the COVID, but because they have higher pressure or cardiac disease or diabetes or cancer, and they weren't able to get an appointment or go to hospital because all the hospitals and our focusing was on the COVID-19. So the digital and the technology is the most important thing that we can focus on it and educate nurses, doctors, and or health worker to get used with it and to can work together in the future.
Thank you, Samia. Really insightful pieces. Artur?
For me, I'm most proud of being a gay man and work with HIV and helping my peers and helping my people that for so many years and decades have been invisible for the health system all over the world. And to use this knowledge to take care of these people, I think that's the most proud of I am. And for the future, I think that universal healthcare systems are the future, because we learned this from HIV and we learned this again from COVID. We're not safe until everyone is safe.
Thank you for really ending on that note, Artur, saying, we're really not safe till everyone is safe. And thank you all for speaking on that entire spectrum of, technology is the future. But as we look to the future of healthcare, even though it's based on technology, has to remember that rural healthcare worker in Zimbabwe or somewhere in Manila or somewhere in the outskirts of Sao Paulo by the favela, and making sure that we don't leave them behind, because health equity is really everyone having access to health, regardless of where they live, where they are born, their race, their gender, their orientation, or any of those other characteristics. As we wrap up, we just want to highlight some audience comments. Somebody said there is need for all health workers to collaborate with nurses in order to enhance quality of care. We couldn't agree more. And lastly, we did have a colleague that was meant to have joined us on today's panel from Manila, but unfortunately he passed on Tuesday afternoon. So we're going to observe a moment of silence to pay our respects to Paul Michael S. Tan, PhD RN, who until his unfortunate passing on Tuesday served as the leader of health and informatics at St. Luke's Medical Center in Manila, one of the biggest hospitals in Philippines. He dedicated his life to nursing, nurse leadership, nurse administration, and volunteerism with Operation Smile. So would welcome you all to just observe a quick moment of silence as we pay our respects to Mr. Paul Tan. On that note, we want to thank you all for your time, all of our nurses. Thank you for our audience for staying way past the hour. This is really an important day, and we wanted to be able to showcase and highlight all of this great work. Thank you for sharing your stories on why you went into nursing, what has made you the most proud, the challenges you've encountered along your career. And like we said earlier, that this panel represents generations of nursing. And as you all had said, as part of the way to grow the nursing profession, and Gunilla, I think you mentioned that, is to make sure that all generations of nursing are part of the people who train nurses, so that people like Caroline with 50 years of experience in nursing or somebody like Gunilla, who has been able to leverage technology to work in the field of nursing and healthcare, or Artur, who is working to address people that would consider marginalized or underserved, or Samia, who in her multilingual French, English, and Arabic is able to cater to a wide spectrum of patients, or Stembile, who is our only nurse midwife on this panel, who is able to showcase leadership within that field. And like she said, let's not forget that rural nurse somewhere in Zimbabwe or in Manila, or even in rural US or in Indian country, who would only have a phone, which might not even be the smartphone 5 to 10 years from now. Thank you, Kelvin, for your time and co-hosting this amazing session with me. Thank you for all of our team behind the scenes making this work. Once again, thank you all for joining us. Please stay safe, be well, and please continue to do the amazing and great work you do. And to our people in India, our hearts are with you. For anyone watching, there are many campaigns online where you can donate to the cause in India and to anywhere else that is experiencing not just the COVID pandemic, but other natural disasters. Thank you all once again. Stay safe and be well.
Bye.